Hi everyone. In today's clip, I will talk a little bit about alopecia. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please consult your healthcare provider. So alopecia is a general term for hair loss from any part of the body where hair normally sort of grows. It can be temporary or it can be permanent, and there are a few different causes, including genetics, hormonal changes, autoimmune disorders, stress, medications, nutritional deficiencies, or even hair care products. We have different types of alopecia, such as androgenic alopecia or male-female pattern baldness, which they indicate the causes of for this being genetic or hormonal or androgens, causing gradual thinning at the crown or hairline, and it's common in both men and women. Also, it's worth noting that chronic sort of tightness or stiffness of the scalp muscles and connective tissue can reduce blood flow and oxygen supply to hair follicles, causing alopecia. This is why it's important to start massaging the scalp with proper nutrients few times a day to ensure the stiffness is removed and the hair regrowth sort of starts. The sooner this is sort of attended to, the better the results are going to be. Then we have alopecia areata, which is considered an autoimmune condition where someone will get a sudden patchy hair loss, which can progress to alopecia totalis or entire scalp, or alopecia universalis, which is the entire body. Telogen effluvium, which is triggered by stress, that's another type, and it's by illness, stress, hormonal shifts, and is temporary, and it's sort of like it causes diffuse shedding. Then we have traction alopecia, which is caused by tight hairstyles, and it's preventable and reversible if it is caught early enough. Then we have trichotillomania, which is a compulsive hair pulling, and it is psychological, needing to be addressed obviously that way as such. Then we have centrifugal cicatricial alopecia, or CCCA, which is a scarring and progressive hair loss, usually starting at the crown of the scalp and spreading outwards. This can sort of have various causes, some of which are due to hair care practices and products like tight bands, chemical relaxers, hot balms, or it can be due to type 2 diabetes, autoimmune conditions, or even infections. Conventional treatments for alopecia usually includes minoxidil or Rogaine, which is a topical vasodilator. The side effects, of course, can be scalp irritation, changes in hair texture and color, initial shedding, fast heartbeat, dizziness, swelling in arms and legs, low blood pressure, unwanted facial hair in women, and more. Then we have finasteride, which is an oral DHT blocker. So DHT stands for dihydrotestosterone, which is a potent androgen or male sex hormone derived from testosterone. While DHT is sort of important during fetal development and puberty for male sexual characteristics like body hair and so on, in adulthood it can cause problems, especially for people that are sensitive to it. DHT blockers reduce the production of DHT or prevent it from binding to hair follicles. Women can also experience androgenic alopecia or female pattern hair loss, which is influenced by DHT. However, finasteride or dutasteride are generally not recommended for women, especially those who are pregnant or may become pregnant, because they can cause birth defects in male fetuses. Instead, doctors often prescribe spironolactone, which is an anti-androgen that reduces the effects of DHT, or recommend topical DHT blockers and natural alternatives such as saw palmetto. So the side effects include sexual dysfunction, reduced ejaculate volume, anxiety or depression, breast tenderness or enlargement, and a few more. Then we have corticosteroids, which may also be prescribed as a topical or injection for alopecia areata. The side effects include skin thinning, increased appetite and weight gain, fluid retention and swelling, mood changes, elevated blood sugar levels, increased blood pressure, and more. Then we have JAK inhibitors or JAK inhibitors, which are prescribed for severe alopecia areata. JAK stands for Janus kinase, which is a family of enzymes JAK1, JAK2, JAK3, and TYK2, involved in transmitting signals inside cells for immune system activity and inflammation. These enzymes play a key role in the regulation of immune responses. Alopecia areata is an autoimmune condition where the immune system mistakenly attacks the hair follicles, causing hair loss. This immune attack is driven by overactive signaling through the JAK-STAT pathway. So JAK inhibitors block these enzymes, reducing the immune system's attack on hair follicles and allowing hair to regrow. The side effects of this includes upper respiratory infections, liver enzyme changes, headaches, nausea, elevated cholesterol, mild anemia, and few more. Now, then there is platelet-rich plasma, or PRP, in which they inject growth factors. This is a treatment that uses patients' own blood to promote healing and regeneration. So PRP therapy involves drawing the blood, then processing it in a centrifuge or to concentrate the platelets, and injecting the platelet-rich plasma into the scalp where hair thinning is happening. So platelets contain growth factors and proteins that stimulate the tissue repair. They also improve blood supply to hair follicles and may prolong the hair growth phase. So PRP is commonly used for androgenic alopecia and sometimes alopecia areata. This is a bit expensive and provides sort of mixed results. Then there is low-level laser therapy, which stimulates follicles, somewhat safe, but results sort of vary. On the side of orthomolecular approach, once there is such a diagnosis, you immediately focus on nutritional optimization to correct any existing imbalances. The key nutrients that are used being niacin, biotin, zinc, iron, vitamin D3K2, selenium, omega-3 fatty acids, and protein. Because deficiencies in these specifically can trigger or worsen alopecia. Herbal remedies such as Eucalyptus alba and or rosemary oil, which are comparable to minoxidil in studies, but obviously much safer. Peppermint oil also increases scalp circulation. Saw palmetto is a natural DHT blocker, and aloe vera soothes inflammation. Then there is onion and garlic juice that are rich in sulfur and promote regrowth. Heavy scalp massages as well as lymphatic massages and drainage are definitely helpful. Well, actually, they're needed, sort of, not just helpful. The way to prepare the oils and use them is to infuse some, let's say, Eucalyptus alba along with rosemary and peppermint in castor oil, and leave it on warm heat, sort of for about 72 hours. Then you can use the oil to thoroughly sort of deep massage the scalp. By massaging, I mean you actually need to move the skin on the scalp. So when you put your hand here, you're not just doing this, you're actually sort of pulling the skin on the scalp to ensure that there is blood flow and there is some movement here and it's not stiff. So do this for about 10 minutes or more and leave this on for about 45 minutes, and then you can, or if you want, you can cover it and apply heat, which is better, and then later on you can wash it off. You can also infuse this mixture in black seed oil or sweet almond oil and use it as a conditioner after you shampoo your scalp to sort of massage it and leave it on. And also make sure that the shampoos that you're buying are have less chemicals in them than regular things that we see in the market. So massaging is super important, and lymph drainage from the area is also important. Like the back of the head, you basically follow the end of your earlobe and find the dips in the back of your neck and massage them daily for as long as possible, or at least like 5-10 minutes a day, as well as the sides of the ears or under the ears over here, and also like here, because these are all connected, and you can sort of massage them downwards sort of to do proper lymphatic drainage. On the metaphysical and spiritual and emotional side of this ailment, alopecia is often seen as manifestation of emotional or spiritual imbalance. Loss of protection can be one of the reasons. Hair symbolizes a protective barrier. Its loss may reflect feeling vulnerable or unprotected. Separation conflicts, especially from a father figure or authority. Devaluation, feeling unworthy or unrecognized. Control issues, like excessive need to control life due to fear of loss, with whether it be sort of job, relationship, or identity. So as letting go, like hair loss is sort of symbolic of shedding of outdated beliefs or attachments. Hair as an antenna for spiritual energy, the loss sort of may indicate transformation and encouragement to find value beyond physical appearance. This can also represent root chakra and root chakra imbalance associated with safety, security, and or grounding. Hope this has been helpful. Like and follow for more. Be the light.